Fluid and electrolytes. Body water is an excellent solvent for a great variety of substances, and this includes nutrients and waste products. It also provides ionization of electrolytes. It helps regulate the body temperature by vaporization, and it helps maintain homeostasis within the body. Water balances the equilibrium between the intake and the excretion of water in the body. And it's really important, again, for maintaining the homeostasis of the body. With the intake, humans will replace water daily, but they can only survive a few days at most if they're deprived of water. With the intracellular, it is the larger of the two body water components, and it comprises 40% of our body weight. With extracellular, it comprises 20% of our body weight, and it is subdivided into interstitial, which is the fluid that is between the cells, intravascular, which is the plasma, and transcellular, which would be located in the GI tract, the cerebrospinal fluid, pleural fluid, peritoneal, and synovial fluid. And it represents a very small volume of body water at any given time. Our body fluid contains two types of solutes, or dissolved particles. These are non-electrolytes and electrolytes. Some of the electrolytes include potassium. It is located intracellularly, and functions or signs of imbalance include potassium is essential for normal function of muscle tissue, especially heart muscle tissue. If you have a low potassium, it can cause generalized decrease in muscular activity, apathy, postural hypotension, and an increased sensitivity to digitalis. An excessive amount of potassium causes heart irregularities, ECG changes, or tingling and numbness in the extremities, and it can even lead to cardiac arrest. Excuse me. Magnesium is located intracellularly. Its functions or signs of imbalance. Enzyme action is important for the metabolism of proteins and carbohydrates. And it's also necessary to maintain osmotic pressure and neuromuscular stability, such as calcium. Sodium is located extracellularly. Functions or signs of imbalance. Sodium is essential for regulating water distribution in the body. Basically, water follows sodium. And a deficiency in sodium will cause weakness, dehydration, and weight loss. Excess sodium can cause oliguria, dry mucous membranes, and convulsions. Chloride is located extracellularly, and its functions or signs of imbalance. Well, chloride tends to follow sodium, and a deficit of chloride leads to a potassium deficit, and vice versa. Bicarbonate is located extracellularly. Functions and signs of imbalance. Well, bicarbonate is the most important buffer in the body, and it helps to maintain acid-base balance. If we have an excessive amount of bicarbonate, it causes alkalosis, and deficiencies result in acidosis. A normal range would be 7.35 to 7.45 pH. And then finally, calcium. It's located extracellularly, and functions and signs of imbalance include, calcium is essential for blood clotting, and it's also required for muscle contraction, for example, the heart muscle, and it's important for bone development. A deficit of calcium causes muscular irritability, cramps, and convulsions. The acidity or alkalinity of body fluids depends on the hydrogen ion concentration, and that is expressed as the pH. Again, extracellular fluid pH normal values are 7.35 to 7.45, and that's the optimum level for cells to function at. Acidosis, again, will be a decrease in the pH, and alkalosis is an increase in the pH. Both extracellular and intracellular fluids contain systems to buffer or maintain the proper acid-base balance. The carbonic acid sodium bicarbonate system is the most important buffer system in the extracellular compartment. Other organs in the body also help to maintain fluid, electrolytes, and acid-base balance. Healthy kidneys, skin, and lungs are the main regulating organs by selectively retaining or secreting electrolytes and fluid according to our body's needs. Because cells of the vital organs require precise and constant sources of fluids and electrolytes and correct pH, IV therapy is therefore really important to replace losses that are caused by GI suction, burns, NPO status, diuresis, or diaphoresis, for example. These are the major organs that are involved in homeostasis. And it's really important to understand the dynamics of the water and electrolytes in our fluid. These body fluids are constantly interchanging between intracellular and extracellular, and it needs to be maintained consistently in order to maintain healthy living conditions. We also need to understand how body fluids move from area to area. The first type of movement we'll talk about is diffusion, and it's the random movement of molecules and ions from an area where there's a higher concentration to an area that has a lower concentration. Osmosis is the movement of water across a semi-permeable membrane, such as a cell wall, in response to osmotic pressure. Well, osmotic pressure is proportional to the number of particles that are in the fluid, and it's measured in milliosmoles. It develops when two solutions of different concentrations are separated by that cell wall or the semi-permeable membrane. It's greater at the venous end of the capillary, and it's regulated by electrolytes and non-electrolyte particles in the fluid. So if the extracellular fluid contains a large number of particles and the intracellular fluid contained a smaller number of particles, the water is going to pass from the cell into the extracellular space until that particle ratio is equal. In this case, the cell might be deprived of necessary fluids, that necessary water. Active transport is a mechanism that's used to move molecules across that semi-permeable membrane against a concentration gradient. It requires cellular energy to accomplish it. An example is the sodium-potassium pump that uses energy to keep the sodium in the extracellular space and the potassium in the intracellular space. Otherwise, they would tend to equalize over time. And then finally, filtration is the movement of the solute in water through the semi-permeable membranes from an area of higher pressure to an area of lower pressure. And this pressure is called hydrostatic pressure, which is exerted in the capillaries by the pumping action of the heart. The direction of this pressure is to push fluids out of the capillary and into the interstitial space. Colloidal osmotic pressure is the pulling pressure that's created by the proteins within the blood, and it acts to draw fluid into the capillary. The balance of these two pressures keeps the fluids within the capillaries. An example of abnormalities of hydrostatic or colloidal pressure abnormalities would be patients that have had traumas, sepsis, or major surgery, and they are now looking at third spacing. So, manifestations of fluid imbalances would be we see symptoms of dryness of mucous membranes, a decreased skin and tongue turgor, weight loss over a short period of time, except when we see the third spacing. 2% is considered a mild loss, 5% is moderate, and 8% or greater is a severe loss of body fluids. We might see a decreased body temperature unless there's an infection present. We may see altered sensorium, a CVP or central venous pressure that is less than 4 centimeters in the vena cava, a decreased urine output of 30 mLs or less an hour for an adult, a weak, rapid pulse, slow filling veins in the hands, marked oliguria, which is a late symptom of fluid deficit, postural hypotension, and flattened neck veins when the patient is in a supine position. In the labs, we will probably see an elevated hematocrit and an increased BUN. We treat this by correcting the cause of the deficit and returning the extracellular fluid to a more normal level. Fluid volume excess is manifested through an acute weight gain over a short period of time. Again, 2% is mild excess, 5% is moderate, and 8% or greater is severe. We see peripheral edema, pulmonary edema, distended neck and peripheral veins, a bounding rapid pulse, a central venous pressure or CVP that is greater than 11 centimeters of water in the vena cava, polyuria if we have normal renal function, ascites or a pleural effusion, and slow emptying hand veins. Labs would show us a decreased hematocrit and decreased BUN. And again, we treat this by trying to correct the pathological process if at all possible. We can also limit fluid intake, restrict sodium intake, and administer diuretics.